Hello and welcome to the Prostate Pod, brought to you by Prostate Cancer Research. I'm your host, Ben Monro-Davies. This podcast is especially personal to me as my dad sadly died of prostate cancer, and is why I'm passionate about sharing the stories, science, and people driving progress today. In this episode, I'm joined by David James from Prostate Cancer Research, who will be offering expert insight into the latest research and what it means for men and their families. David, welcome.
Hi, Ben. How are you?
Great to see you. Let's get started. I know you particularly want to talk about Prostate Progress. What is this exciting new project?
So Prostate Progress is a patient data platform that Prostate Cancer Research launched in July 2024 in partnership with the NHS. And this, just to take a step back for a moment, I think to give you some context, we all in the UK have an NHS number, which links important medical information about us. Now, the problem that we face is this medical data can be found in silos right across different parts of the country, particularly if you move around at all. Maybe you're treated in one hospital and then another. And what that means is we have all this incredible information that we hold about people, but it's scattered all over the place. And so that prevents us from having a really clear picture and understanding of a disease, of the disease trajectory, how we can better treat it, how we can better support and care for people who do have the disease, and how we can actually, assess the risks of getting the disease. And so what Prostate Progress does is it brings together this disparate information and like pulls it together like a puzzle, a jigsaw puzzle, and fits all these pieces together. And it does this, and we're doing this in partnership with the NHS because all this data is held by the NHS. But we're also doing it in partnership with patients because one of the things that the NHS rarely captures is some of that what we call quality of life information. It's the stuff that you don't really get asked very often, but it's, hey Ben, you're having this treatment. How does this making you feel? What's the impact this is having on your life? So it's really important we bring that information alongside those kind of clinical information to then help researchers get a better understanding of the disease, to help our doctors and nurses and clinicians better help us decide what sort of treatments we should be having, kind of more evidence-based approaches to our treatment, and also to really just supercharge research and get people access to clinical trials and new types of medicines they might not have been able to previously access before. So that's Prostate Progress in a nutshell.
That sounds incredibly sensible, but I imagine it's rather harder in practice than it is in just expressing it over a podcast. How do you get hold of this information?
So at the moment, all this information within the NHS, it sort of exists in its different disparate places, but it's why we're having to do this in partnership with the NHS, because we're having to work with, at the moment in England, 11 different secure data environments. Each of those is a sort of regional hub that kind of surfaces data from primary care level, from secondary care level, so from sort of GPs and hospital practices, and pulls that up into that sort of regional secure data environment level. And these secure data environments, they're at different kind of levels of maturity as such. So we're at the moment, we are testing this with three of those: London, the West Midlands, and the Northwest of England, with plans then, as this testing develops, to scale that into, at first in England, the rest of those secure data environments before moving to the devolved nations. So that it's a very big sort of technology and software exercise on the one hand, but the other is some of the things you might not think about. There's but the really important bits, the informational governance. So making sure the right data access agreements are in place, making sure the right sort of security and transparency is in place, that the permissions are there for this data to flow. And then from the kind of quality of life, that patient perspective, well, that's where we are working with the patient community and asking people who have ever been diagnosed with prostate cancer to join Prostate Progress, because in doing so, they sign up, and they can do this from your phone, a tablet, or a computer. And then you're asked to fill out periodic questions about yourself and your health. And that information Prostate Cancer Research captures. And then we're sharing that across into this database with the NHS that we're building with them. And then all of that information is kind of securely anonymized and then available to researchers who've, approved researchers to, use that data to answer approved research questions, which are in the public benefit. So they have to go through all sorts of steps to make sure that those, that the right people can access that data. And then they are able to analyze and sort of export, some of those outputs from that data to help us answer some of those questions. So there are lots of different pieces, as you say, like there are 15 different work streams all happening simultaneously, pulling these different bits together. But it's a really exciting project, and actually, it's the first of its kind here in the UK, and it's why we were actually named a network driver project by NHS England's Data for Research and Development program, because of the really sort of unique nature of this work that we're doing.
When you say the first of its kind, is that about prostate cancer or just the first of its kind across the board?
So actually, kind of across the board, there are registries that exist in many other countries, and these capture certain kind of types of data. You have a very big registry in Sweden, for example, on prostate cancer. There are registries which collect certain bits of data, but where this is really unique is both in capturing the data we're having in prostate cancer, the linking it then to that clinical information, and this building this what we call a longitudinal data set. So we're asking people who join to come back every, say, 6 to 12 months to share more information, and we're going to keep doing this for as long as it takes to really ensure that we can, the prostate cancer is no longer the scourge it is today. So that might be 10, 15, 20, 30 years. But this is going to capture and build this understanding of the disease over many, many years and help researchers long into the future. And then the other bit that makes it really unique is the scale. There is no country in the world that has the scale of data that we have in the UK, because of that unique NHS number and the universal healthcare system that we have. And then finally, it's the ability to recontact people. And that's a really key part when we were developing this with our patient community, who actually, we have a number of patients who sit on our steering committee and an expert patient panel, is that we've heard from patients that they want to also benefit from this, participating, not just giving back through sharing their data and helping researchers in the future, but one of the key benefits is also being able to put them in touch with clinical trials. So being able to kind of act as a matching service between patients and clinical trials, and letting patients know that there might be a trial or there's a new type of precision medicine in the future that comes out, that we can say, we can analyze, the results that someone has sort of shared with Prostate Progress, and kind of match them to it and tell them about information that will help them improve perhaps their treatment outcomes in the future through this kind of matching process. So there's a kind of whole range of ways that this is unique, but we're really excited actually, whilst we're kind of blazing the trail in prostate cancer, one of the key additional benefits, I think, is that we see, and the partnership with the NHS is how they will then roll this out into other disease areas as well. And we're already speaking to other nonprofits in this space, as well as other industry partners, to think about how that can then scale to other cancer types. So there's a huge benefit in being involved and helping us shape Prostate Progress.
I can certainly speak to that as somebody who's been involved with prostate cancer research for many years. It has always been and is a pioneering organization. And I think a lot of people were fascinated here when normally you think of prostate cancer research, I guess you think of the lab. This is a project that's essentially a technology project.
Absolutely. Yeah, there's, this project will benefit as well, researchers, not just the ones that we support at Prostate Cancer Research, but researchers really around the world, to do and understand prostate cancer and how it evolves and how it changes and the impact of treatments and drugs. So this has wide-ranging benefits for the research that we fund, and I think it's going to help supercharge that research that we fund. But it also has benefits for all the other different bits of work that we do at Prostate Cancer Research, from the influencing advocacy work we do. It's going to help us gain a better understanding of the disease and the inequities that we know exist in this disease, by providing us much more up-to-date information and data that we can use then to campaign for better government resources into prostate cancer, finding out where those postcode lotteries exist and where some of those challenges in the system are. So it goes beyond, just that research. But right, as you say, it is in many ways, it's a big technology project. And it's why we're working closely with the NHS. There's, we work a lot with their software and data teams, but we also have support from external organizations who have that kind of technological capability. Prostate cancer research is, we don't have 15 different data scientists, and software engineers, but we are working with reputable organizations to help us build that and to do this effectively.
And where are you on your prostate progress journey? Where is the project as we speak?
So we launched this in July 2024. We've been working on this now for about 4 years. It has over 4,000 people who have been diagnosed with prostate cancer who have already signed up and who are sharing their experiences of the disease. We have, as I mentioned, we're working with 3 of those NHS secure data environments in England. But we already have plans now to roll that out to at least 7 of the 11 in England, and that we hope is going to be happening next year, 2026. And what that means is we're already in a place that this is actually being used already by researchers. We've already done a pilot matching patients to a real life clinical trial. We're answering research questions that we previously wouldn't have been able to do before around treatment variation and prescribing practice, for example. And then there are a whole host of areas that we're already using it for. But really, where this is going to be extremely powerful is as we start to scale, right? So we consider this relatively small, in that I mentioned there's about 4,000 patients, but we have plans next year in the middle of 2026 to scale that to 40,000 or more people who we hope will join Prostate Progress and participate. And the scale, when we do that, when we get to 7, 8, 9 of these secure data environments, is it's going to give us close to England-wide coverage at first. It's going to give us a large enough data set that's going to enable us to answer questions that are just not possible unless you have that kind of big data kind of mindset and understanding and be able to really dig into nuances that you can't do with much smaller data sets. So I would say we're definitely, to use sort of a running analogy, if we were running a marathon, I would say we are past the 1/3 mark of the marathon. We've done some of the hard kind of graft, but there are some significant kind of challenges on the way. And if we get to 40,000 patients next year, and once we've get that linkage on sort of 5 or 7 of these secure data environments, I would say we were definitely in the sort of last. Gosh, now I don't know how long a marathon is. 26 miles. Let's hear in the last.
26 miles. Don't stretch the metaphor too far. We get the message very clearly.
Yeah.
And we'll ask about how people can financially support in a moment. But for somebody might be listening to this who unfortunately has got prostate cancer and so on, and might want to become part of the project. How do they do that?
So to participate in Prostate Progress, you simply go to our website, which is www.prostateprogress.org, and you'll come to a home screen. And what you'll do is be prompted to create a sort of an account. And what you do is you'll just need to enter some bit of information to create the account. You'll be asked to sign a consent form. So we would ask you, do read that carefully. There's a participant information booklet which we've created with our patient panelists to really kind of explain in some of the detail, what are some of the risks and benefits of joining, some of the questions that people often ask. They're all in there in that booklet. Now, once you've completed that consent form, you'll then be participating in Prostate Progress. You will then be prompted to answer a series of questionnaires, and there are 2 main ones initially. The first one is called My Prostate Cancer Experience. And so that's asking you a little bit of information about yourself, the types of treatments you might have had, or maybe not had if you're on monitoring. A bit about your diagnosis, when you were diagnosed. Share your NHS number so we can do that linkage. And then the second set of questionnaires is called My Prostate Cancer Health, and that is a set of what are called validated data instruments. So those are patient-reported surveys which have been developed by researchers and tested over many, many years, which there are 3 for everyone to complete. And what those will do, we will ask you to come back every, say, 6 or 12 months to complete those again. And those will allow us to sort of map and see how your condition is changing over time, how your quality of life changes over time as, for example, maybe you have another type of treatment midway through that year. How's that impacted your quality of life? Or just, maybe you were treated 3 or 4 years ago, but is your quality of life changing, as some of the after effects of that treatment are being felt further down the line? So it's as kind of simple, really, as just doing this from your computer or phone or tablet at home, and you'll just receive an email kind of reminding you to participate. But then there'll also be other opportunities that will come, periodically, opportunities to participate in research or clinical trials, and those will come, and pop into your email as and when those are available.
Okay, that's a very clear explanation, and I would encourage, I think, give great meaning and support to people who are enduring prostate cancer to feel that they're contributing to the fight to find a cure, as it were, if that's the right word, or find new treatments. And look, this is a charity podcast. We're always in the business of rattling tins and trying to raise money, but coming up to Christmas in particular, I think there are ways people can support financially.
Absolutely. So we're really excited that we're doing a campaign with the Big Give, which is going to see that every donation from midday on Tuesday, the 2nd of December to midday Tuesday, the 9th of December, all gifts up to £90,000 made via our Big Give campaign will be doubled, which is incredible. And that money is going to be going to support that scaling, as I talked about. So we are doing a project next year with the NHS to write to everyone who's ever been diagnosed with prostate cancer in England, contacting them and inviting them to take part. And so that this Big Give campaign is going to specifically help us, do that work and scale. So to have your donation doubled, you've got to visit the Big Give at donate.biggive.org. And there it will say, do you want to explore campaigns? And you type in prostate cancer research. There's also a direct link which we can share in the the show notes as well, because it's a bit complicated. But just a flag, if you do want that and your money to be doubled, you have to give during that week from Tuesday the 2nd of December to Tuesday the 9th of December from midday to midday. But of course, all donations are always welcome, and you can just typically do those at Prostate Cancer Research's website, which is pcr.org.uk, outside of that usual outside of that Big Give campaign.
Oh, well, that's very exciting, but really, please, anybody listening, if you can make the most of that week to give money to such a fantastic cause. Just mentioned, I mean, obviously patient voice is very important to this. Why does PCR value the views of patients so greatly?
There are tons of reasons why it's important, but I think just to kind of think about one in particular, if we're funding research and we fund research and we don't involve patients and we don't involve people who've been affected by this disease, you can spend years funding this research project, going down this kind of path, thinking this is a great idea, can go into a clinical trial. You can spend millions, tens of millions of pounds getting us through a clinical trial to the point when you get it approved for the NHS, and then suddenly you realize that this is actually not something that is suitable, or it doesn't benefit patients in the way that they really want or need, or it's not appropriate the way it's being distributed, disseminated. I'll give you an example, right? And this is a slightly facetious example, but it's true in the application of this. Is imagine you had to have an injection of a particular type of drug 5 times a day at a hospital site, and that had to go on for 6 months in order for you to prolong your life. Now, obviously, if you just kind of take this out of context and go, great, well, if you can prolong someone's life for 6 months, that's a good thing, perhaps at a sort of late stage of disease. But in the process of having to travel all that time, to spend so much of your life being, having injections, just the quality of someone's life would be absolutely atrocious. And people would say, absolutely not, I'm not going to do that. And so whilst that's a facetious example, the point stands is that it's really important to involve people, ask them what it's like to have this disease, where are those kind of pain points and challenges, what is and isn't acceptable in treating them, and what impact does that have on their quality of life? Because in the past, we've focused a lot just on quantity of life, like how do we extend someone's survival, which of course is important, but it's important to make sure that survival is a good quality survival, not just survival when that quality of life is really minimal, because many patients then would say, I'd rather take a good extra year than 2 extra bad years.
Well, it's very neatly expressed about why patient voice is so important. And certainly my father's experience, we learned a lot about what he needed rather than what we wanted to give him, as it were, in terms of treatment. So thank you very much for expressing that. And in that spirit, we've got some questions here from supporters of the charity. So I'm afraid I'm going to have to put you on the spot and ask you some questions, but I'm sure you'll be more than able to ask them. The first one is from Deborah Smith, and I'm afraid Deborah's father died of prostate cancer. Here's her question. My dad died aged 89, having had prostate cancer for 19 years. He wasn't suitable for surgery, but received many different and often novel treatments from Addenbrooke's that helped extend his life. His cancer journey was different to the thousands of other people living with prostate cancer, and theirs is also unique. I'd just like to share my sympathy with Deborah, having lost my dad to this awful disease. Her question is, the point is, how do we raise awareness that everyone will have a different experience living with prostate cancer? I'm struck by how so many people seem to think there is one prostate cancer, one journey, one experience, one identical treatment, one identical set of PSA numbers, etc., etc. David, that sort of connects with what you were just talking about.
Yeah. So, first of all, Deborah, I'm really sorry to hear about the loss of your father. So, I think the Prostate Progress, really what that is doing in the scale that we're trying to achieve, is by having as many people participate as possible, by ensuring that we can connect up these different data sources, these kind of clinical data sources around the country, and the size and the sort of scale of the NHS that I mentioned that makes this really both unique and so incredibly significant, is going to enable us to really better understand the disease, to understand there are so many different ways this disease presents. There are some that are more aggressive. There are some that are less aggressive. You can sometimes hear in some researchers talk about the pussycats and the tigers, for example. There is a lot of sort of heterogeneity of the disease, but without data, we're never going to be able to understand that other than sort of anecdotally. And so it's even more important that people take part, as many people as possible take part, because that will help us truly understand the disease, the nature of the disease, the type of treatments that work better, to test some of these theories out. And then ultimately, once we have that information, then making sure that we can, as you say, raise that awareness, Deborah, sort of share the knowledge and the insights that we learn from that amongst the patient population, amongst the clinical population, and ensure that some policy changes appropriately to, in line with the facts.
Okay, thank you very much, David, and thank you, Deborah. A rather more specific question here from Chris Fletcher. How many men on hormone treatment are suffering from depression as a result of the treatment and having advanced prostate cancer, and what can be done to help them?
Well, Chris, first of all, if this is about yourself, I'm really sorry to hear that you're suffering from depression. I think this is one of those questions that we Prostate Progress is going to help us answer, right? Researchers will be able to answer questions just like this, and more, because of the fact that we're able to bring together all these different data sets. And firstly, I'd encourage you, Chris, to sign up to Prostate Progress, because the information you share will be really valuable to helping those researchers in the future. On a more practical level, if you're not aware of our educational website, the Info Pool, I would certainly encourage you to take a look. And that website is www.theinfopool.co.uk, because that site has over 1,000 stories of people who've been affected by prostate cancer, have different types of treatment. And you can filter those stories by things like treatment. So you could go on and look for people who've had hormone therapy. And there people are sharing some of the kind of practical tips, their experiences being on treatment, and what it's been like, and some of the side effects they've felt, and some of the things they've done to overcome these side effects as well. So whilst I can't perhaps give you a specific number, there are lots of other men who are struggling with treatment, who's sharing some of the tips that have helped them overcome some of these challenges. But hopefully, in the future as well, Prostate Progress is going to help us better answer that, and better find ways to look for those things that go, okay, well, what's unique to these people who are not suffering from, say, depression? Is it because they had a slightly different type of hormone therapy, or is it the how the frequency with which they had the kind of hormone therapy injections or pills, and looking for patterns that will enable us to hopefully improve the sort of quality of life of people on treatments in the future.
Thank you, David, and thank you, Chris. This one from Alfonso Archer, and I know this is a subject which is very important to prostate cancer research, the organization. Alfonso's question: given the long-standing evidence that Black men face a 1 in 4 risk of prostate cancer and are diagnosed later and treated less consistently, why has the NHS still not introduced ethnicity-specific screening guidance? And how will Prostate Progress ensure that the data collected finally leads to policy change rather than just becoming another well-intentioned project that fails to shift clinical practice? David, a hard-hitting question there. What do you think?
Yeah, it's a great question, Alfonso. I mean, in terms of why, as many of you will be aware, we're currently running a campaign to try to get screening introduced in the UK, starting with those men at higher risk, which includes men of Black ethnicity and also men with certain genetic variants like the BRCA1, BRCA2 gene, and men with a relevant family history, so those with prostate, breast, or ovarian cancer in their family. The National Screening Committee is looking at this. It last looked at this back in 2020, and it is reviewing it at the moment. And we are due a sort of an interim decision which will go to public consultation this year in 2025. So we are literally, they're actually meeting next week when we're recording this, but it's on the 27th of November that they're meeting. So we should have an indication right now as to, well, very, very soon as to whether that shifts. And I'm hopeful that will shift. We've been campaigning hard, providing the evidence, trying to put the pressure on the politicians, demonstrate that public support. As to why it hasn't happened sooner, we could probably do a whole podcast episode on why. So I'm probably not going to go too much into that. Maybe that would be something useful if they do say no, to understand why. But I think there have been some historic concerns around the type of test and causing too much harm. But we feel strongly that the evidence is now in favor of screening, and the pathway has changed, particularly with the use of MRI, etc. But how does kind of Prostate Progress fit into this? Well, I think Prostate Progress fits not only into this, but to the wider kind of conversation about sort of health inequities that you brought up, Alfonso. It's not just about sort of the lack of screening, but it's also about why do Black men have a higher mortality rate, irrespective. Why are they being treated less consistently? And there are sort of a lot of other health inequality questions which transcend ethnicity. We know that men in more deprived parts of the country are more likely to die of prostate cancer than those in least deprived parts of the country. And so Prostate Progress is going to help us by bringing this data together of the kind of this macro data across the UK, and allow us this much more kind of real-time understanding of the disease, because a lot of this data that we're looking at in 2025 is data from 2022, there's a time lag of a couple of years, and we still talk about this as if this is current. That needs to change. The level of granularity that we will have about the disease, about areas of the disease, about people based on ethnicity, sexual orientation, age, a whole variety of things, is going to just give us so much more power when we're then trying to campaign for change. But unless people participate from these communities, unless we have Black men participating in Prostate Progress, and I know Alfonso very well. He's sits actually on the patient panel and is very sort of supportive. But it's a really important question, right? Is how do we ensure that we reach the right men and bring them in? Because if we don't, then Prostate Progress will unfortunately not be as powerful as it well could be. So I think number one is we need to make sure from everyone who's listening that is taking part. We all have a duty to take part and kind of step up. My background actually is I used to work in political campaigns and started out in the US working on campaigns, and I was out there knocking on doors and telling people, right, democracy fails when we don't show up and take part. And I think it's the same in sort of health and medical research, as if we're not willing to sort of show up and take part, then we can't. It's very difficult to then go, oh well, why aren't you doing this? well, if that information isn't there, or we're not willing to sort of provide that information, then it becomes much more difficult to sort of say to researchers, this is a problem, and we need to find a solution unless we can really see the problem. So there are responsibilities from us as individuals, but then we need to make sure as an organization, particularly, we're going to be pushing for that change, and we will campaign hard for that. Health equity across the board is something that PCR is very passionate about, from the research we've funded, and to the sort of charitable activities we do, and we will continue to campaign hard on that and to deliver to ensure that we have much more equitable access to diagnosis, treatment, and care across the country, and to ensure that Prostate Progress doesn't fall into one of these kind of well-intentioned projects. And I think finally, just to add, is that partnership with the NHS is probably the thing that's going to make sure that this goes from being a project that's just being done kind of by PCR and hoping that we can then sort of institute change, and is by doing it with the NHS. We're embedding the kind of the process and the system and the project into their sort of ecosystem, and we think this is going to make it much more likely that then the information we discover and the ways we do things will lead to more systemic change in the future.
Yeah, thank you for that answer, and thank you, Alfonso, for everything you're doing to help prostate cancer research. And then finally, I mean, Alfonso's question hinted at it. It's the big question. It's the big issue facing prostate cancer detection at the moment. Here's a question from Dave. How much closer are we to having a national testing program?
A great question, Dave. I think we're certainly much closer than we were a few years ago. I'm not a betting man, but let's say I'm hopeful that we are going to see the National Screening Committee recommend a targeted screening program, starting with those men at highest risk in their next review. We think that the evidence is there. The pathway is much safer than it was 5 years ago, particularly thanks to MRI. We've seen some great new data coming out of clinical trials recently, a 23-year follow-up from the ESRPC trial, which showed that the reduction in mortality caused by prostate cancer screening at 13% is comparable with breast and bowel screening programs. There's data from reports that PCR produced this year and last year. The one last year had modeling from Deloitte, which showed that screening program is cost effective. And our most recent one, with modeling by Karnal Farah, shows that a screening program is, in terms of the cost to the NHS, is comparable with other screening programs. It's a relatively modest workforce increase and 0.01% of the UK's NHS budget. So, I think some of those kind of main problems that we used to think about in the past that were kind of blockers to screening, don't think those exist anymore. So, this analysis is going to be taking place right now from the National Screening Committee. They've done some their own modelling to assess this, and we'll see very soon where the chips fall. But I'm hopeful that we're much closer than we were, and I'm hoping in 2026 we'll be talking about how do we implement a screening program rather than when are we going to get one.
Yeah, well, again, that's something that PCR has been banging the drum about for a long time, and quite rightly so. David, that was fantastic. Just to reiterate, in case anybody missed it, the joys of podcasts and on-demand listening is they can replay and hear again. But you just want to remind me where people can donate for the Big Give?
Yeah, absolutely. So from midday Tuesday, 2nd of December, to midday Tuesday on the 9th of December, you can donate to our Big Give campaign. All gifts up to £90,000 will be doubled. And to have your donation doubled, you must visit the Big Give at donate.biggive.org and explore campaigns for prostate cancer research. Or you can directly type bit.ly, so ly, /PCR-BG25. But remember, only gifts made via the Big Give appeal page can be doubled, and only for that 1 week period. But outside of that week period, you can just visit our website, pcr.org.uk, and click on our donate button.
and you can only give up to £90,000. So
So
those of you who can only afford £89,000, this is the place for you. Okay, David, that's been absolutely brilliant. Thanks to you, and thanks to everyone for listening.
thanks so much for having me, Owen.